You get that too, yours.
All right. So, um, thank you all for joining. I really welcome you to talk about this very important topic. And it's a topic that's personal for me, which I will tell you about in just a minute. But I do want to say that what I'm going to do in this presentation is present a summary of research and facts about osteoporosis and movement that's known to be safe and effective. So nothing I say is, a prescription, and certainly I'm not giving medical advice. I have a lot to say about certain topics in medicine, but I'm not giving any advice. This is knowledge about yoga and movement, and you should always do what's right for you, having consulted with your physician. Okay, so I just want to say that. But yes, this topic is personal for me. I've had a diagnosis of osteopenia for many years, and I am now 66. And I really credit, healthy lifestyle, healthy diet, healthy living as much as possible. And more than anything else, I think the practice of yoga, the regular practice of yoga for my osteopenia, not becoming osteoporosis. Now, my mother had osteoporosis, and she was on a medication for many years for it, which I think was, very, very popular back in the day, maybe even for prevention. I'm not sure. It was a while ago. And, she broke her hip, and it needed a surgical repair because, in her old age, as the surgeon said, it'll be too painful if we don't operate. And a few weeks later, she passed away. And I think that was just the final assault for her. So it is personal. And so what I'm going to do is tell you a little bit more about myself. And I'm going to tell you the way this evening is going to go. And then we'll take it from there. But I have been teaching yoga for about 13 years. And up until last year, I was teaching part-time because I was working full-time. And I worked clinical healthcare in hospitals and doctor's offices for 30 years. And now that I am happily retired, I am able to pursue my passion, which is yoga, and really taking some deep dives into health topics that make a difference for us as we age, and making a difference by educating and by teaching appropriate yoga, so that we have healthy years, health in our years, and not just longevity. That's really important to me. So that's what I'm about. And currently, I'm teaching. I teach online on Zoom, and I'm teaching a chair class and a gentle mat class, as well as some of these themed courses. So this is how the evening's going to go. The first part will be a conversation and some education. And the second part, we'll do some yoga postures that are safe, and for a diagnosis of osteoporosis. And then we'll close it with another conversation, a shorter one, just to answer any remaining questions and comments, and to talk about what might be next for us. So I read actually all of your forms that you filled out when you signed up, and it looks like we are all here for the same reason. Either we're not necessarily dealing with osteoporosis, but we're interested in the topic, or we are in some stage of osteopenia, osteoporosis, and have certain different interventions for it. Some of us have a yoga practice. Some of us used to have a yoga practice. and others of us are interested in movement, flexibility, things that yoga provide. Okay. If you would like to introduce yourself or at this point ask any questions or state any of your concerns, then certainly feel free to do that. This is a great time to do it. You don't have to, but if you would like to, this is a great time. Just jump right in. Don't wait for me to call on you. Okay, nothing at this. Yeah, go ahead.
Hi, my name is Renee Kaplan, and fortunately I met Janet. We belong to a women's group under EMA, and we have about 14 wonderful women, well-traveled and coming from lots of different professions, and we meet once a month to talk. And Janet once, it's been many moons, sponsored
many years.
sponsored a yoga class for our group, and it was just wonderful, and just opened up lots of good things. And then of course we moved into the pandemic and life goes on, and here I am again. So it's kind of coming full circle where, yes, I had osteopenia for many years, and it's moved into osteoporosis, and I'm taking some medication, but I do my thing, but I'm very interested in adding yoga to my routine.
Awesome. Well, thank you for sharing that, Renee. Anybody else have any questions or comments at this point? There will be other opportunities. Okay, so let's get down to the educational part, or some of the things I want to say. So maybe we should just define our terms. Osteopenia is bone loss, and it's the precursor to osteoporosis, which is the condition when your bones become brittle and likely to break. So those are the definitions. Now, the most common fractures are of the spinal column, the wrist, and the hip. The most insidious of these fractures are the ones of the spinal column. So I'm going to pull my little model over here. And this is the front of our spine. And each of these are a vertebra. These are the vertebral bodies. And this is the place where we have those, when we have osteoporosis, we get those silent fractures. I call them silent because they're not necessarily painful. And we may have them and it may be unknown to us. But when we get these little fractures at the front of the spine, the vertebrae start to collapse on one another. And so when that happens, we start to get kyphosis, or in other words, a rounding of our spine where our head will come forward. And that sets into motion a whole cascade of events that we really don't want. We kind of lose our body awareness and our balance. We have a lack of coordination and strength, and a huge increased risk of falling and of fracture. So that's the danger of osteoporosis. And the way, the road in is the road out, which I'm going to talk about, because I know some of you who are here are not, don't have a diagnosis, and some of you already have a yoga practice. But it's the same things that prevent osteoporosis are the things that will build bone and build strength and diminish our chances of losing balance and falling. And those are the yoga postures that will build bone. And let me just enlighten you with a couple of other things. But the difference is that there is movement that is safe for people with osteopenia and osteoporosis, and there is yoga that is not safe, right? So that's something that we're going to talk about as we practice. But another couple of important statistics that I want to share with you are as follows. a full 25% of Americans die within a year of a hip fracture. 25%. Now, that was my mom, right? And another 25% will never leave a skilled nursing facility after a hip fracture. I think those are pretty alarming statistics, and I certainly don't want to be one of those, and I don't want anybody I know to be one of those. But there is good news, right? Bone cells do grow stronger and denser with the practice of yoga. And there are two ways that that happens. One is using gravity. And when we do postures such as powerful standing postures and balance postures and postures that are designed for that in a chair, we build bone density. And we also build bone when our muscles pull on the bones. That strengthens the bones. And that describes every yoga posture and movement that I know. Our muscles are pulling on the bones. So those are the methods in which yoga will strengthen bones and make a difference for osteoporosis. There was a 10-year study done by Dr. Lauren Frischman, and I'm just going to give you the summary of this study. This group concluded that yoga is a low-cost and less dangerous alternative to medications and can reverse bone loss. The benefits include better posture, improved balance, enhanced coordination, greater range of motion, which we need for our tasks of daily living. I mean, if you think about how much we turn when we drive and reaching for things, and the list goes on and on. Higher strength, reduced anxiety, which is interesting. Of course, yoga we know is a mindfulness practice, and better gait, which refers to the way we walk. And that is from that study, which I'm happy to send you if you would like. So we know that the practice of yoga is empowering, not only physically, but mentally and emotionally. And, another thing that yoga does is we improve the awareness of our body, how we're holding our body in space, because those are things that the practice of yoga developed for us. So that when we know where our body parts are in space, we're more likely to catch ourselves if we start to fall or things like that. So, and it also contributes to our overall sense of self-care. So let me see what else I might want to mention that I haven't already mentioned. Of course, there's a lot, and I don't have time to go into it all, but we've touched on quite a lot of it. So here's another thing that's very interesting. So it's falls, not osteoporosis, that are the highest risk for fractures. So it's not having osteoporosis that's the highest risk for fracture, it's falling. Because 54% of women who have hip fractures do not have osteoporosis. So what that means is that there's more to look at than just bones, right? So the other thing that, in addition to falls, would be frailty. So frailty is something that's not inevitable as we get older, but it does happen for a lot of maturing adults, who maybe they had a sudden onset, a health assault, like, an accident, some sort of trauma, or maybe a stroke, something like that. And that is now causing them to be frail. But more often than not, it's caused by diseases that may be diseases of lifestyle or other diseases, and lack of appropriate movement and physical exercise, right? So preventing frailty and preventing falls, as well as building bone, are a huge, huge goal. And that's those are all things that yoga can make a difference for. Now, a lot of people who get the diagnosis of osteoporosis either self-limit behavior that could be beneficial to them, or they get poor advice saying, you know, you can't do this now, you have osteoporosis, or you need to be careful of that. And people are instilled with a fear. And I'll give you a perfect example. I have a very good longtime friend who lives in Texas, and she came for a visit. She joined a chair yoga class of mine where there were women in their 80s and some in their 90s who were all, you know, doing everything that I, you know, was teaching. And she sat there. And I didn't know what was going on. So when the class was over, I asked her, you know, what was that about? And she said, oh, my doctor told me that I can't, you know, do any kind of twisting, and I shouldn't do this kind of movement and that kind of movement. And unfortunately, I mean, this friend of mine really does kind of live a very small and not vigorous and vital life. And that's very heartbreaking for me because it doesn't have to be like that. As a matter of fact, our spines need to be strong. There are so many muscles that come off this, you know, the spine. And these are the muscles that we need to be strong so that our bones are strong. But these muscles also catch us when we're about to fall. You know, they're very, very important for our vitality, lifelong. So we need those muscles to stay independent, to stay functional. So in short, the goal for of yoga for osteoporosis is to empower people with the diagnosis that in a safe way, they can become stronger, they can prevent fractures and build balance to avoid falls. And along with this goes, you know, building confidence in our everyday living and, you know, enthusiasm for things that we can do versus what we can't do. And very necessary so that we can carry on the tasks of daily living and not become dependent, right? So before we move to the movement part, are there any questions or comments that you would like to share? Ask or share. We're good? Okay. So let me ask you this. As we move to the movement practice, is there anyone who is not comfortable laying on the floor, on the mat, or on the mat with blankets or on blankets? In other words, a hard surface that might be padded. Is there anyone who would prefer to sit in a chair and do their movement? Okay, so we're going to do a few poses, and we'll do them on the mat. And then we'll do a couple of poses in the chair. And if I have time, I'll show you a couple of really great poses against the wall. And we'll see how we do for time. All right, so at this point, if you would like to move to I'm gonna switch my camera so you'll be able to see me. Let me turn this off. And as I said, anytime, you know, during the movement portion, also, you can certainly speak up and ask a question. So another thing you should know about me is I am continuously studying and learning yoga, and I study with experts. And the movements that we are doing are yoga therapists who specialize in bone health have, these movements have their stamp of approval. So those are some of the things we're going to do now. And some of them if you've been taking yoga classes, then you've already seen these. So we're going to start out on on our back. And if you would, at the moment, I'm not going to use my blankets, but if you'd like to have a blanket, under your head or whatever, you're welcome to do that. We're just going to take a minute or two for breath to become present. So I invite you to lay down in a comfortable position, a relaxed position. And of course, if you prefer to do your breath seated in a chair, you're welcome to do that. But go ahead, just lie down. You could close your eyes for, a minute or so if you like. And we're just going to begin the practice by focusing on our breath. Because yoga, first and foremost, is a practice of the breath. And I could spend many, many classes, not just minutes, talking about the different types of breath and the benefits of the breath. But for now, we're going to use it to center ourselves, to become present. And the way we breathe in yoga, as many of you already know, if possible, it's in through the nose and out through the nose. And we want to inflate the lungs from the bottom to the top. So as soon as we inhale through the nose, we send that breath right down to the lowest lobes of the lungs. And then we hold it and breathe into the ribs and then up under the collarbones. And as we exhale through the nose, we'll release that air in reverse fashion. So first the breath leaves the top of the lungs, the middle, and then the bottom of the lungs. And, this is the perfect way to activate our parasympathetic nervous system, the rest and relax part of our nervous system. So anytime that you're feeling, that you need some calm and relaxation, you can do this type of breathing. And the only other thing I'm going to say is that we're going to allow our movement to follow the breath. And what we're going to do now is are some pelvic tilts. So we're going to bend our knees and have our knees and feet in line with our hips. And we wanted to do some pelvic tilts for several reasons. So I'm going to explain to you how we're going to do this. And then as you're doing it, I'm going to talk about why we're doing it. So with our arms, palms facing up, either down by our sides or out at the shoulders, probably down by our sides, palms facing up. We're going to press down into the feet and pull the body forward on the inhale and feel a little arch in our back. So there's now space behind the low spine. And then on the exhale, we're going to press down into the feet and press the body away. And we'll notice our pelvis tips backwards. So now our spine is in contact with the mat. And maybe our belly is turned on a little bit more. So again, with the inhale, press into the feet, pull the body forward. Notice the arch in the back. On the exhale, press down into the feet, press the body away, and notice the pelvis tilt towards the body. So continue with this, with the rhythm of your breath. And this is important. What we're doing here is becoming aware of our pelvis. We're loosening our low back. And we want to know where our pelvis is and how it's positioned in space for all of our yoga postures, be them on the mat, standing, or seated. We want to know what it feels like when our pelvis spills forward and the back arches. We want to know what it feels like when we press away, our back flat and our back flattens. All right, now for a moment, let's just come back to our starting position. And we're going to take our fingers and just tuck them, not the whole hand, but see if we can tuck our fingers underneath our lumbar spine, our low spine. And that would be a sign of a neutral pelvis. So our back is not arched and our back is not flat. So that's something that's important to note. So we're going to move on from here. And for this, we want our block, our yoga block. And if you didn't have a block, I said, you know, grab a shoebox, an empty shoebox. But if you don't have a shoebox, you can also do this movement without, and maybe a thick book, although that would be pretty heavy. You could also do this movement without a block, but we're going to place that block between our thighs. So the block is on the narrow setting. And we're going to have our knees above our hips and our lower legs parallel to the floor with our feet flexed. Our hands can either be palm face up, down by our sides, or we can have them extending out from the shoulder, whatever works best for you. Now, if this is, as soon as we assume this position, we notice that we're working in our core. So we really want to pull in around the waist to support our back and to stabilize our back. And these are the muscles that are also going to help our back increase our bone mass density, rather. All right. So we're squeezing the block. Our feet are active. So we're going to inhale here through center. And on the exhale, we're squeezing the block. We're squeezing it around the waist. We're going to allow our knees to go to the side without tipping our body up and over. And we're going to take a full inhale and exhale here. So notice that we're feeling this in the side waist on the opposite side. This is a core strengthener, a spine strengthener, and a leg strengthener. And then we'll inhale, come back through center. On the exhale, we'll allow those knees to go to the other side. Again, we're not rolling up and over. We're keeping our torso flat on the mat, and we're hugging in around the waist. So full breath cycle here. Then on the inhale, let's come back through center. And on the exhale, return to the first side. Hold this while we take a nice inhale and an exhale. On the inhale, come up through center. And on the exhale, we'll go to the other side. And for the purpose of time, this will be the last one, but we're going to take a full breath cycle here. And then we'll come back through center. And let's put the block off to the side and hug the knees into the chest. So this is, as I said, a great core stabilizer, core strengthener, and very safe movement for osteoporosis. So the next thing that we're going to do is I'm going to show you a safe way to, if you don't already know it, a safe way to come from our backs to another position. So what we do is we hug our knees into our chest. And let's say if we're rolling onto our right side, we extend the right arm up. And with bent knees, we roll to the right. So we rest our head on our right bicep. And then we place our left hand in front of our body and our left leg. So in other words, the top leg, whichever side you're on, the top leg moves forward as we press into the top hand and tuck our chin. And then we use our arms to push us up in a safe way. And our head is the last thing that comes up, so it protects the neck. So for this part, you might want a little extra padding, a little extra blanket. Let me check on our time. Okay. So we're just going to do one pose of forearm plank. So this is a good strengthener for our shoulders and for our core. And, you know, having a strong core supports a strong spine, right? And a strong core is key to balance, absolutely key. So we're going to place our elbows under our shoulders, and then we're going to clasp our hands. And then we're going to walk our feet out, curl our toes under, and we're now in forearm plank. Now, the most important thing here regarding osteoporosis is that we do not want, I'm going to show you what we do not want, any kind of rounding in the spine, because we're compressing our front vertebrae. So we want to press down into the elbows, pull the elbows and the feet toward one another. So a lot of core work. Anytime you want to put your knees down and come back up, you can do that. But we want to do this with a straight spine, right? And I'm sure that we can feel, you know, the strength of the core, and that we're strengthening our back muscles, which strengthen our spine, as well as our shoulders. All right, enough of that. So we're going to come out of that. And now if you like, you can move your towel or blanket underneath your knees, because we're going to be on our knees right now. I'm putting mine off to the side, but certainly if you have sensitive knees, you can put your knees down. So we're coming to tabletop position. And this is where the knees are under the hips and the wrists, elbows, and shoulders are aligned. If your wrists are sensitive, you're welcome to make a fist instead of a wrist here. So let's extend the right leg back with the toes curled under. Keep the toes on the mat. And let's extend that left arm forward with the fingertips on the mat. So as soon as we did this, I'm sure you felt that you needed to engage your core a little bit more. So now we really want to hug in around the waist, front, side, and back. And from the right inner thigh, we're going to lift the right leg, and then we'll extend the left arm. So this is called a spinal balance. And this, again, is good for the entire cylinder of the core. And it's also a balance posture, right? So it builds our spinal health, and our balance. So let's release, and we're going to do one more on the other side. So left leg goes back, toes curled under, or the second leg, whichever leg you didn't extend before. The right fingertips, right arm is extended, fingertips on the mat. So feel that we've already needed to engage our core. Now we're going to squeeze in around the waist, the entire front, side, and back. And then we're going to lift the leg and float the arm. So we're activating the core. We're pulling the hand and the knee on the mat toward one another as we reach the fingertips and the foot of the lifted limbs away from us. A lot going on here. This is excellent for our back body strength and our spine. As I said before, our core and our balance. All right, so let's come out of that. And we're gonna go into a child's pose. Now you think child's pose is the most innocuous pose that you can do. And child's pose is a great hip stretch. But if we've got osteoporosis, then we don't wanna be rounding our spine. So here's what we do. Child's pose. By the way, if it's child's pose, if doing this is uncomfortable for your knees, you would take one of your blocks and put it under your pelvis to prop that up. But what I want to show you is typically in child's pose, we're like this or like this. And notice how rounded the spine is. So we're going to take our block and put it under our forehead. And we're going to rest our forehead on the block. And we're going to use our arms, our forearms, our elbows underneath our shoulders to help support us. And notice hopefully I've taken the curve out of the spine. So now you can enjoy child's pose without worrying about osteoporosis. Very good. All right. So I'm not going to let you stay here too long. Sorry about that. We're going to, let's see, what else do I want to do? All right, I'm going to show you a down dog on the wall in a tree pose. If you are someplace where you can see me and hear me and you have a piece, then you can do these poses. Otherwise, you could just watch, and they're certainly simple enough for you to practice. But I want you to know about them. A wall is a prop that we use a lot in my classes, a piece of a wall. So we know about downward facing dog on the mat. And there's the risk of rounding your spine there if you're not doing it properly. So a way to do it on the wall is to, can you see me? I'll back up. Is to put your hands up. And from here, shift your hips back. Now notice this is a downward dog shape and my spine is straight. Now, I could also bend my knees if that makes it a little bit more user-friendly. So I'm really hugging in around the core. And these are all the benefits of downward facing dog, the back stretch without the inversion. So now we're going to do a tree pose. So I'm going to show you a tree pose on the wall. Now, if you don't have a piece of wall handy, but you have a chair handy, then you could grab your chair. So I'm going to show you both ways. And then one more posture we'll be seated in the chair. So if you've got the chair, then you're going to hold on to the chair, and the leg closest to the chair will be your supporting leg. And we can bring the sole of our foot to the ankle. We can bring our calf to the, or rather our sole to the calf, or we can come up higher. You don't want to ever press on the knee joint, right? So this is an example of a balance pose where the gravity is building the bone strength, especially in the standing leg. Now, take note of the pelvis. When we discovered what that neutral pelvis was on the floor, we want to have that neutral pelvis here. In other words, we don't want to be spilling it forward. We don't want to have it tucked. We want to have our neutral pelvis, a long torso, reaching the crown of the head up and squeezing in or around the waist. So that's your option for the chair. And I also want to show you, it's pretty cool to do against a wall because there's very little risk of falling. So here, my leg closest to the wall, I got to back up a little bit, closest to the wall is the balancing leg. And again, I find one of my postures. Now, you never want to open your knee all the way because now I've taken my pelvis out of alignment here. So you always want the pelvis neutral, front to back and facing forward, right? So I'm just going to leave my leg here. But I can move away from the wall. None of me is touching the wall, but if I'm concerned about falling, I've got the wall right there. So take a moment to do it on the other side, if you did it on the first side, and then we'll move on. Are there any questions at this point? Questions or comments? Okay, so make sure you do your chair on your rather tree pose on both sides. And now if you've got a chair, I'd like to do the last two poses in the chair. I'm going to show you one of the poses that we do in our chair class. So we're going to sit on the seat of the chair. And we're going to open the legs wide, make sure the knees track over the toes. And we're going to engage in around the waist, all the sides, front, side, and back. And then we're going to hinge forward from the hip creases. So notice we need a strong belly and to support that long spine. There's no bend in the spine here. And then we're going to bring our arms up. So we inhale here. Now on the exhale, we're going to come up onto our feet without straightening our legs. And this is what it will look like from the side. It's this. So what are we doing? A lot of weight to strengthen our legs, our hips. Our spine is straight, so it's safe. And our core is working. We're building the strength in the spine, and we're practicing balance. So that's what that pose is. And then we find our chair as slowly as we stood up. So we're going to inhale here. On the exhale, pull in around the waist, hinge at the hip creases, press up. And then on the exhale, slow and controlled, we're going to lower back to the chair. So we'll just do a couple of those. So when we're doing any kind of movement with osteoporosis, we want to avoid bending the spine. All right, and let's release. So the very last thing I want to show you is a twist. And as far as twisting goes, that's what the move that is cautioned against the most, twisting. And there are dangerous twists for osteoporosis or any back, but especially osteoporosis, and there are safe twists. So the safe twist is done when we're already lengthening the spine, we're already hugging in and activating our core to support that spine. And then we turn only from the rib cage, and we never force a twist. We never go further than what we can twist. So you can do it sitting here in the chair if you like, or I'm going to show you a version standing. So for sitting in the chair, we're going to, again, the core is on, the spine is long, we're reaching the crown of the head up, and we're going to take opposite hand to the outer opposite thigh. We're going to inhale nice and long, and on the exhale, we're only going to twist from the rib cage, just a small amount. And notice we're not taking our head back either. That's not healthy for the neck. So each inhale, we lengthen. Each exhale, we twist a little deeper. Now I'm going to show you another way to use the chair and do a safe twist. For those of you who are able, you can put your leg on the spine. Now you want to have, make sure that the supporting leg, everything's aligned. In other words, that your back hip isn't moving forward, right? So nice straight leg, long spine, reaching up, hugging in. And then we're stabilizing the pelvis. Notice it's in a nice neutral position. I don't have an arch. I'm not rounding my back. And I'm going to inhale here. And on the exhale, I'm going to place my hand outside my bent knee, bent the thigh, the bent leg here. Then I'm going to inhale again, create a little more length. And on the exhale, I'm going to press my hand into my thigh so that I can rotate my ribs. So each time I inhale, I get a little bit longer. And each time I exhale, I rotate a tiny bit more, never forcing the twist. And that's a safe twist for osteoporosis. We need to be able to twist to maintain our range of motion for our everyday movements. And go ahead and do your twist on the other side. Whichever twist you're doing. So this type of twist strengthens our wrist because we're pressing our wrist into our thigh. It's strengthening our arm and our shoulder, certainly strengthening our core and our spine. It's a balance pose, and it's also really building the bone density of the standing leg as well as the spine.